This is the prevalence of mice in pancreatic cancer research. The topic of pancreatic cancer raises some important questions, like what does the pancreas even do? How does this cancer occur and what are the symptoms? Is there a genetic component? How are mice involved? Whoa, let's stop there. These are all valid questions, but in order to answer them, let's backtrack. Let's start with the first known description of pancreatic cancer, which is attributed to Giovanni Battista Morgagni in his 1761 publication, which describes it. However, due to the lack of microscopic evaluation, it makes the true diagnosis of pancreatic cancer uncertain. The next important advancement in our understanding of pancreatic cancer did not come until 1858, when Jacob Mendes da Costa revisited Morgagni's original work and described the first microscopic diagnosis of pancreatic cancer as a true disease entity. The first reported attempt at removing a pancreatic tumor was performed in 1898 by the Italian surgeon Alessandro Caldivia for a tumor involving the head of the pancreas. In that same year, William Stewart Halstead from Johns Hopkins Hospital performed the first successful resection for papillary cancer by excising portions of the pancreas. The first successful pancreatic duodenectomy is credited to the German Sherman Walther Karl Edward Couch as a part of a two-stage procedure. In 1914, George Herschel performed the first successful pancreaduodenectomy in one stage. In 1935, Alan Whipple presented the results of a two-stage procedure involving the resection of the head of the pancreas and the duodenum for papillary carcinoma at the annual meeting of the American Surgical Association, which renewed interest in pancreatic surgery. The procedure evolved into a one-stage procedure, and Whipple is credited to popularizing the operation. Okay, now that we have the history down, let's explore how pancreatic cancer even develops. Pancreatic cancer occurs when cells develop mutations in their DNA. These mutations can sanction uncontrolled growth and can form a tumor. If left untreated, the tumor can spread to blood vessels and organs nearby. The most common form is in the duct that lines the pancreas. So what are some symptoms? Some symptoms include pain in the abdomen or middle back, nausea, fatigue and loss of appetite, or jaundice and weight loss. Anything else we should know about pancreatic cancer? Actually, yeah. Let's take a look at some statistics. Pancreatic cancer is one of the few cancers for which survival has not improved substantially over nearly 40 years. Pancreatic cancer has the highest mortality rate of all major cancers. 74% of all patients die within the first year of diagnosis. Pancreatic cancer is the third leading cause of cancer-related death. However, the 5-year survival rate for people diagnosed at an earlier stage with the local disease is 32%. The 5-year relative survival rate for people diagnosed at all stages of this disease is 8%. So what are some treatment options? Some treatments include chemotherapy, chemotherapy-protective drugs, surgery, and radiation therapy. So how are mice involved in all of this? Through mouse models, scientists have developed new strategies for early detection, chemo prevention, and treatment, and identified the modifier loci related to tumor initiation and progression. Experiments from 2002 and 2003 replicated tumors similar to those in humans in mouse models. Medivert was found to block drug resistance and boosted the positives of radiation therapy and increased survival rate by 50%. So who made these advances? These scientists include Robert A. Reinberg and Annapurni Ragnarajan, Indian Institute of Science, Bangalore, India, Terry Van Dyke with Tyler Jacks in 2002 and 2003, and Cedars-Sinai Medical Center this past September. Now let's look to the future. Here are some examples of what scientists hope to achieve through mouse models in the future. The reason that mouse models are important for pancreatic cancer research is because the more mouse models there are, the more drugs that can be tested and the more lives that could be saved. So thank you, mouse models, for helping scientists pioneer new treatment options and helps increase survival rates for cancer patients like my Nana, who was diagnosed with cancer last year. Also, thank you to these resources, for without them, this project would not have been possible. Thank you for your attention.